Hello, everyone. My name is Ms. Reese, and I will be presenting the female anatomy and physiology. Let's start with breast. The female body is composed of breasts, two to be exact. The function of the breast is to produce milk, which usually happens during pregnancy, since the milk is a form of nutrition for the infant. The production of milk occurs in small structures called lobules that are within the mammary ducts. These ducts connect and come together, which eventually the milk exits through the nipple. Remember, there are different shapes and sizes of breast. Everyone is unique in their own way. Check this out. Here we will be watching a quick video that introduces the female anatomy and physiology in just 2 minutes. This will prepare you for the next following slides. Enjoy.
Just like people's bodies vary in their appearance, people's sexual and reproductive body parts can also look different from person to person. Most people have internal and external reproductive parts. A person who is biologically female will have external parts that include the vulva. The vulva is made up of the pubic mound, the inner and outer lips of the vulva, called the labia, the clitoris, which is a spongy tissue that is very sensitive to touch, and the external openings of the urethra and the vagina. The urethra is the hole through which a person urinates or pees. Behind this is the opening of the vagina. People often use the term vagina for what is actually called the vulva. The vagina is inside the body and is the canal that leads to the uterus. The vaginal canal is usually 3 to 5 inches long and has the ability to stretch and shrink as needed. Only the opening of the vagina can be seen from the outside. Finally, behind the opening to the vagina is the anus. Internally, a person who is biologically female has 2 almond-sized organs called ovaries that contain a lifetime of tiny eggs. Generally once a month, an egg is released by an ovary and travels down the fallopian tubes towards the uterus. The uterus is an amazing organ that has the ability to expand to nurture and grow a fetus if and when the person becomes pregnant. Each month when there is no pregnancy, the uterus sheds its extra lining through the cervix and down the vaginal canal. Wow, our bodies are pretty amazing. Don't forget to take good care of yours so you can stay healthy and happy.
Great video, right? Let's learn more about this.
Just like people's bodies vary in their...
As mentioned in the video, the female body has internal and external parts. Here I will review some of the internal anatomy parts of the female reproductive system. Let's start with the vagina, which is located right here. The vagina is a tube that connects the cervix to the outside of the body. Next, we have the cervix, which is located right here. It's the connection between the uterus and the vagina. The uterus, also known as the womb, because a fetus, which is a baby, grows here during pregnancy. Next, we have the fallopian tubes. There are 2 narrow tubes that carry eggs from the ovaries to the uterus. Last, we have the ovaries, which stores eggs. Now we will be talking about the female external anatomy. The external part of the female anatomy is called the vulva. Remember, don't mistake this for the vagina. As mentioned in the video, the outer part of the vulva is called the labia majora. My labia is unique. There's different shapes and shades. Keep the pubes. It is important to consider that some vulvas have pubic hair, some are trimmed, or some are completely shaved. Everyone is free to do what they want to their body. However, pubic hair is intended to keep bacteria from entering the vagina. So keeping some pubic hair can be a good thing. Let it breathe. Clothes are a form of expression, and I'm sure all you have great styles. However, do not forget to always change your clothes and underwear every day. Also, breathable underwear will keep your vulva dry and will prevent the growth of bacteria that can cause some infection. Keep track. Vaginal discharge is normal. However, the color can say a lot about what your body needs or any concerns. Therefore, if you notice vaginal discharge has a strange color, has a smell, or notice something that you have not seen before, make sure you contact your doctor right away. That is all for this part of the presentation. Thank you, everyone.